Today's episode is brought to you by the Pleasure Pods, an all-natural, body-loving lubricant and moisturizer that supports confidence, comfort, and pleasure at every age. Stay connected, stay empowered, and stay beautifully unmuted. Welcome to Unmuted Podcast, your midlife roundtable, where we have honest conversations, real stories, and expert insights on the wild, wonderful ride of midlife. We're here to break the silence and remind you you're never alone.
Welcome back to another episode of the Unmuted Podcast. This is our place where all the shame dies and we have open conversations about midlife, menopause, relationships, women's health, and so much more. I'm Amanda and I'm filling in for our usual host, who is Serena, but she's away today. So I'm really excited that I have the opportunity to introduce our guest speaker, and we're going to have an awesome discussion with her. Her name is Brooke Gordon. Brooke is a leadership strategist, facilitator, and advisor who works with leaders navigating disruption, change, and high-stakes transitions. With more than 2 decades of experience across strategy, human resources, and organizational leadership, she brings a practical systems-level perspective to conversations about care, capacity, and decision-making. And Brooke has an amazing story as well to share with us today, which I hope will inspire women out there who are listening to this podcast today. She has a personal journey of breast cancer and how that experience has shaped what she does today to help other women. So hopefully you will be inspired. And if you have your own breast cancer journey, I just want to put out there that this could be a bit of a trigger. So this is kind of a trigger warning on this particular podcast. So welcome, Brooke. Welcome to Unmuted.
Thank you so much for having me. We are so excited to have you here. And Amanda, thank you so much for stepping in for Serena. You know, we've got myself and Lisa also joining to share with Brooke. And I think just to start, Brooke, as Amanda said, let's get into your personal story that really has inspired me through this journey that you've shared on Instagram. So can you share that with the listeners?
Thank you for this opportunity to share. I will start by saying not everyone chooses to share their journey. And the reason why it's important to me is because the statistics say 1 in 8 women will be diagnosed with breast cancer. And I know way too many. It just feels like the numbers are even higher in the circle that I have. And I've been so blessed to have guides who walked this journey ahead of me. And so I'll tell you my story and how it started. I was too young to be eligible for a mammogram. And I'll mention that because I want to come back to it later. So imagine being on holiday. It was Jean-Baptiste Day, which is a holiday in Quebec. It's this like perfect window where it's like a long weekend in Quebec, and then the week after is Canada Day. And so my spouse and I decided to go to Montreal. And it's morning, the sun's peeking in, I'm getting dressed. We've got like a whole day planned ahead of us. And as I look down, I realize my nipple's facing the wrong direction. So I panic, as you might also. I'm poking around and I don't feel anything. But it's sitting in the back of my head. Something's not okay. So I go to Dr. Google and I start researching and I see things like an infection or different reasons. I'm like, oh, this isn't good. I'm away on vacation. So I book an appointment with my family doctor to come back. It's not till January 2nd. And I try to go and have a lovely holiday. And then 3 days later is when the pain started and the lump started to appear. What I learned afterwards is that I wasn't going to feel it because of where it was positioned. The lump was directly behind the nipple, which is a spot that when you're doing your self-exam is harder to get to because it's tender. We don't tend to push as hard there. And also there's inflammation around the tumor. And so that's one of the reasons why I hadn't felt it, because I did regular breast exams, so this came as a real shock. I was so blessed, ladies. My doctor took me seriously. There's been many cases in the past, and I say this because many women I know, their doctor was like, it's fine, it happens. And because it sort of came on quickly, she said, it could be a cyst, but let's get it checked. And so she booked me in to the hospital, and she said, I really want you to go for an ultrasound there because they're able to do a biopsy right away. And this was really important to her. She said, I can get you an ultrasound anywhere. That's not what I want for you. So it's 3 weeks. And why is it 3 weeks? Because of the wait list, because there's so many women getting tested. So I did. I called to book an appointment with my family doctor because I wanted to have that conversation with her first. For anyone who does go through this experience, if you go through the formal, it's called a couple different things. Mine was a diagnostic, like breast diagnostic, it's DAP. When you do that, you get put in with a surgeon right away. So you get your results from the general surgeon. And I know this because one of my girlfriends had walked this journey before me, and she warned me, and she said, listen, they're going to ask you, do you want a mastectomy or a lumpectomy? And I was like, what are we talking about?
Yeah.
And sure enough, it's exactly what happened. So we found out from my family doctor. We drove straight from her house to my parents' house because they lived nearby. My spouse just burst into tears when he walked through the door. So my very first experience of dealing with the diagnosis and sharing the diagnosis, I didn't say anything. I just had my parents come. My mom just grabbed the two of us into this huge hug. She told me later that she went completely weak at the knees, and she's like, no, I need to stand tall for her. And so that was sort of the start of our journey. A couple days later, we met with the surgeon, and sure enough, it was, I'm sorry, but you have cancer. Do you want a mastectomy or a lumpectomy?
So can you just explain to us the difference between those two? Because a lot of listeners may not understand that exactly, right?
Deborah, this is it exactly. I was like, I don't know what you're talking about. I don't even know what that means. What is this decision that you're asking me to make? And what I learned afterwards is this is actually a strategy that they have to get you out of shock and into curiosity. Because you're immediately going to be like, either you have a strong opinion about this because it runs in the family and you're like, take them, I don't want them, or you don't and you're like, I don't know what you're even talking about.
And I'm also very curious, how old were you when you got your diagnosis?
This was 18 months ago. So I would have been 40, oh gosh, I'm not good with ages, 46, 47 when I got the diagnosis. It was before my birthday, so I was 46. Yeah.
Okay, so the difference basically is saying that either you want to keep your breasts or you want to get rid of your breasts.
Yeah, there's so many options. I'm just so that you know, when you come away from the hospital, you end up with like binders of pamphlets and papers and info. It's wild. And this was the first one. And so we spent some time talking about it. A lumpectomy is when they remove the tumor and surrounding tissue. A mastectomy is an amputation, and they remove the breast. Yeah.
That's really
at its
helpful.
simplest.
Yeah. And is there any research showing now when women are going through this, how many of them actually just have the lump removed and how many actually have their breast completely removed? Is there any research on that?
That I don't know. I don't know the answer to that. No.
Okay.
I do know that the techniques that they have are incredible. So in that biopsy, one of the things they did is they inserted a surgical clip. So it's a little, almost like a little microchip that they put in at the site of the tumor so that for some people, it may not be cancer. It might just be an anomaly, but they want to track it going forward. And it allows the radiologist to find and track exactly, because now they can align to this clip. And it's like a tiny little piece of metal. And in surgery, they use it. They actually have almost like a little wand, because they did it before the surgery. She's like, okay, let's check that it's where it is. And she showed me, and it starts beeping. So the surgeon's not doing exploratory surgery. They've got a CT machine over top of me, and they've got this little clip, and she knows exactly where she's going.
And it's interesting you say that, because I went and had a mammogram done, right? I'm very, very good in keeping up on my mammograms. And they found something in one of my breasts. And because it was so difficult to find, like, I'm telling you, I don't think I've ever had my breast squeezed so many flipping times, and not a comfortable squeeze, let's put it that way. And they finally had to put that in so that every time I go, they now can see it clearer and much easier because they've got that in my breast. So I can really appreciate what you're saying about that, because sometimes it can be very challenging.
Yeah, it's almost a little bit reassuring in some ways. My spouse and I am an engineer by training, and so we had this joke that now I've been tagged. But at the same time, I'm delighted that they've got this level of surgery. surgical
Right.
techniques.
I'm wondering if I'm going to be beeping when I go through the airport security, which I'm not. So, yes.
Yeah, I haven't traveled since I got it, so I didn't get a chance to test that either. But the team is really great because I have a mild latex, like a contact allergy to latex, and so I was like, "What is in this?" And they wouldn't. My biopsy took longer because they were calling the rep, they were calling the manufacturer because it didn't expressly say latex free, and they were like, "We're not putting it in you."
No.
The other thing I really appreciate for anyone who may have some hesitation about this, I had said, "What happens if I have a reaction to it?" And he said, "Here's the thing, we take it out." And he says, "If you have it, these are the things that it enables for us. If you don't have it, then, it's not that we can't proceed. It's just, it gives us more precision." And he said, "And if it's bothering you, we take it out." And he said, "So there's not really a downside in terms of risk," because I appreciate it. I always ask, and we'll talk about that later, but I always advocate to ask for the risks.
And there's
Yeah.
so many different, depending on whether or not your lump is in situ, what they say is like just in one spot, versus if it's kind of hit the lymph nodes and stuff. There's so many different treatment options now. In your case, what was like some of the treatment options that they offered you, and what was unexpected about it?
I love that questions. So my treatment plan was extensive because of the diagnosis that I had. And so rarer form, what they call aggressive, which means that it spreads easily and grows quickly. And because of that, they took fast action. So that 3 weeks, right, from the time I felt the lump till the time that I got my biopsy was exactly a month. So it was June 24th, I felt it. The biopsy was July 24th. I was in the chair August 20th.
And when my next question is, just to piggyback onto this one, was
Yeah.
it hormone receptive?
Oh, I'm going to get to that.
Okay,
So,
awesome.
yeah. So when I say in the chair, so I was in with an oncologist within 24 hours of meeting with the surgeon. And we met with her a couple of days later, and she had said, "Okay, here's the thing. We're going to move quickly." And then she said, "You need some time to prepare, and we need some time to prepare," because she was like, "We're going to start next week." And she's like, "Nope, we're starting in 2 weeks." So I started with chemotherapy because of the size. The tumor was 1.5 inches. And so they wanted to shrink it before surgery. And so that's the route that I went. And then my surgery, they had told me at the time, because of this retracted nipple, that it was highly likely I would lose the nipple as part of my surgery. And so that was, I'll say very openly, that was what I spent the most time in therapy about going into this, was how do I cope with losing a nipple, because I chose a lumpectomy. In the end, she was able to save it. I was really blessed. I responded well to the chemotherapy. The tumor shrunk and let go of what had been pulling it backwards, so she was able to spare it. All of the incisions, she used the edge of the nipple, so my scarring is so minimal. I'm very blessed that way. But the lump she took was right in the middle of my breast, so it's a little Picasso-ish in shape. And I mentioned earlier about the tissue around the lump. That's called margin. They want to take nice healthy tissue, because sometimes when you cut into a tumor, it doesn't like that and it starts growing again. So they called me and said, we did some pathology, we checked they check every little slice of what the tissue they take out, and they said it goes right up to the edge, which means we didn't get enough clear healthy tissue on the other side. We have to go back. So I had to do a second surgery 3 weeks later. What they found, Amanda, my initial diagnosis, or I should say the initial diagnosis, was for something called HER2 positive, estrogen positive, progesterone positive. So it's called triple positive. That means that there's receptors on the tumor cells that use our natural body's hormones and signaling to grow. And so it had the HER2, which is a growth hormone. And then it had the two estrogen and progesterone hormones, which is why it can be, they call it prolific. It can easily spread and easily grow because it's got access to all of these beautiful hormones signaling it to grow and be healthy.
Yeah.
However, when they did they call it pathology, when they come in and look at all of the cells, they found a second tumor in the same location. And that one was estrogen, progesterone positive, but not HER2 positive. So it was a completely different type of tumor. There's over 50 different types of breast cancer. They think about it
Really?
as a disease. Yeah, we think about it like a diagnosis. Like someone says you have diabetes, for example. Well, there's 3 different types of diabetes,
Yeah,
right?
but what's interesting I find here, Brooke, is that with diabetes, people either have the 1, 2, or whatever the different one is. You had 2 different ones for that. Is that something that's normal? Because I would think that if you have breast cancer, you have one of them. But it sounds like you
But
had
you
2
can even
different
have
ones.
breast cancer that's not hormone responsive.
One of my friends has that. There's no
Yeah.
hormones
No
associated.
hormones involved at all.
They don't fully understand why it grows. I'll answer that question in 2 parts. The
Yeah,
first
yeah.
one is they don't know. But one day while I was at the hospital, I had this lovely woman come in, and not my case nurse, who I had regularly, and not my oncologist, who's someone else. And she's got, like a checklist, and she's going through and asking me all these questions. She's smiling. She's very friendly, but she's very cut to it. And so finally I said, you didn't get a chance to introduce yourself. Are you a resident? And she said, actually, no, I'm a pathologist and I am doing rounds today. So I have a chance to meet patients because normally I'm in a lab with a piece of you on a microscope. And so it was a chance for me to interact. And I said, oh, you might find my case really interesting. The pathology came back that there were 2 different types of cancer in the same location. And she said that used to be rare. It's not anymore.
No.
Mm-hmm.
Oh,
Yeah.
wow.
I want to jump in here for a second because we're talking about all the science, which is super important. And I know we're going to get back to this. And I know, Amanda, you are so good at driving the conversations in these ways. And one of the things, when you were telling the story about having the conversation with your family, I felt myself dissolve.
Oh,
And been thinking about this conversation today. I was like, oh, we're going to talk about breast cancer because we hear about it so often. I think we sort of become numb to it. But in listening to you talk about your family, it made me think about in my own personal circle, I have 5 women, all in and around my age, who have been diagnosed with breast cancer in the last 3 years. And so when you're talking about things that used to be uncommon and are now common, and what are the actual numbers, and what does that actually mean for us? Right? I will never forget being with one of my favorite humans on the planet. She and I were just going for a walk, and she's like, Lisa, I have to tell you, I'm really sick. And that was her telling me about the beginning of her breast cancer journey. And so I think thank you, Brooke, for sharing your story with us. Absolutely. All the signs and what we can do in the treatment are so important. And I think it's important also that we don't overlook the humanity of it and the impact on you. And clearly the reaction I'm having right now, I didn't even realize how much grief I was holding for all of these beautiful women in my life who have been through this incredibly and are on this incredibly transformative and painful and challenging journey. And how, I guess I'm wondering, how are you moving through that right now and your circle of support as well? Because it splashes out on everyone, right?
Lisa, I want to start by thanking you for honoring me, sharing what's been in your heart, listening to me. Thank you. There's a couple things. I actually refer to it as a fire journey. If you ever see me type about it, it's got like a little fire emoji. It's for 2 reasons. One, I know a lot of people don't like talking about cancer, the C word. There's a lot of people who are very averse to it, and it can be triggering. So that's part of it. But the other part is I had this image at the very beginning of walking across hot coals. It's one of those journeys where if you look up to the end and you keep walking at a steady pace, then you come through unscathed. But if you stop and you look down at your feet, you will pause long enough to get burned. And so I want to answer it in a couple ways. One of them, I chose to be very open and transparent about my journey. It started with a WhatsApp group that my friend had actually recommended. She said, create a group and put your updates there because otherwise you're going to be updating like everybody. It's going to be exhausting for you. So it was an easy way to do that. The second thing I did is I started afterwards posting more about it online because I didn't want to disappear, honestly. I didn't want to just disappear. But I also didn't want to come on and say everything's fine. It's not fine. I had no eyebrows, no eyelashes, and no hair. I'm not fine.
Mm-hmm.
But there was a hardness that I had to take on for myself to get through it. I had to have I have rituals. I'm going to the hospital actually to see my oncologist later today. So I was really looking forward to this conversation because I'm hoping it'll give me a couple more things to advocate for. But I have a bracelet that one of my girlfriends made for me. It's my Wonder Woman cuff. And I wear that to all of my appointments. It is part of my armor to get through this because you have to choose to show up at the hospital every 2 weeks. You have to choose to take, and from my case, it was an IV right in my chest. If you can believe it, the trade name is a power port. I had a power port in my chest. I was like, okay, yes, I like this. And you're there for sometimes hours. So my mom was a huge part of my support circle. I'm very blessed to have both my parents with me, and I have a very loving relationship with my parents. My mom's actually an artist. This is one of her pieces.
Wow.
And
She's good.
thank you.
Yeah.
She is. She really is. Kim Gordon.
Yeah.
And one of the things that she came with me to all my appointments. My spouse came with me to every, and I don't want this to be morbid, but my spouse came with me to every first treatment with a new medication because he's my power of attorney.
Okay.
And there's a risk of allergic reaction. And so that was important to him and I that he be there because he was my voice. And then once we knew that my body was tolerating the medication, then my mom would come with me and we made it fun. We colored and we talked for hours and we brought a lot of joy into the day. We treated it as a chance for the two of us to spend more time with each other than we do on a regular basis. And here I am every 2 weeks getting to hang out with my mom for a whole afternoon, if not a full day. So that became some of my anchors and how I chose to start speaking about it.
It's interesting because I know that family is very, very important around this process, but I also bring into this is friendship. Speaking to what Lisa's going through, and Lisa, I am so sorry that you have 5 friends. That is not, I don't even know what even to say. That is just brutal. So no one should ever have to go through that, and especially someone who has 5 people that they know. But I think one of my things I wanted to ask you, Brooke, is that did social media, because I know that's how you and I got to know each other, is through social media. And I was following your story, and your story was very impactful to me because I had lost a friend with ovarian cancer. And I know, and it was very sad for me because my dear friend died in her very early phase. And, I was with her through all of that process. And the sad thing about it is that she had lost her father to cancer. She had lost her stepfather to cancer, and she had lost her mother to cancer. And the sad thing is, her mother and her were in the hospital at the same time, her mom fighting brain cancer and her fighting ovarian cancer. And her mom died 6 to 8 months before she passed. So the journey and what she had been through, no one should have to go through because she dealt with it from all of her family members. And all that's left today is, of course, her children, her husband, and her 2 brothers. The rest of the family has been wiped out by cancer. So cancer to me, and I said to you earlier, Brooke, call it the C word because I don't like it. I don't like what it's doing to people. When you get diagnosed with cancer, it's not like, yes, you go into remission, but it's always with you. It's always with you. So it, to me, and I don't mean this in a mean way or anything like that, it is a life sentence, okay? To a certain degree, that's how I look at it, and as a life sentence. That's just my perspective because I've seen my dear friend and I've seen others, and you're in remission, but you never know, is it going to come back? It's always in the back of your mind. It's always with you. And so to me, how do you carry forward with something like that? And how do you deal with that? Especially, I would think about my own spouse too. Yes, you're going through it. You've got it in you, but your spouse and your family too, that is just such a weight.
Appreciate everything that you just said. And I am also deeply sorry for the loss that you experienced. One of my dear friends, who Amanda is also a personal trainer, and she she's come with me through this whole journey. And so she's literally moved with me 3 times a week from my diagnosis until even yesterday. And we developed different workouts to manage the nausea, to manage the constipation, to keep me moving with through the fatigue. And so at the end of that part of the journey, because the journey's not done, but at the end of that part of this fire journey, she said to me, "Thank you for giving me an experience where somebody lived through this."
It's amazing.
Because she also had that same fear as you. And so I think part of it is a perspective of what you've lived with and what you've experienced. I think for me, perspective has been huge. I'm not gonna use the words here because I know many people are listening, and we've obviously identified a trigger warning. But when I had to take my medication and they're called infusions because they're done by IV over a long period of time. For me, there's many different forms. My friend had said going in, "How are you going to cope? How are you going to cope with this, knowing that this medication is being put into you and it's going to make you feel really sick?" And we created an avatar. I had a whole mental model around it. I will always refer to it as medication and medicine because my doctor is a medical oncologist. She prescribes medicine. And yes, it's toxic. I was what's called cytotoxic. And, if we get into intimacy later, that was a huge, huge part of it. It's also toxic enough that she warned me my periods were going to stop. We didn't talk about menopause. I didn't understand that, but they did. And I lost all my hair. And I kept showing it back up at the hospital to keep taking this medicine. So mindset of how you perceive things and how you choose to perceive things was really important.
I really like about your friend and creating these exercises and things to actually help you through that. And I would like you to share with me in email her information because I'd like to include this in this episode. So if people are interested in reaching out that might be going through this, might have this as a great tool for them to reach out to her to help her because it sounds like it was something that was very beneficial to you.
I would love that. For my girlfriend with the movement, absolutely. My other girlfriend with the mindset perspective, I'm just blessed. I'm blessed to have a great friend who we have good dialogue that way because I'm a coach and she knows me. So
Yeah.
she tries to flip the tables.
But these are very good tools
Yep.
that could help others. You know what I mean? And these are two women that have gone through this journey with you, both mindful as well as physical. And I think it'd be extremely helpful to any other listeners.
And I think one of the, so I'll definitely share Christine Sapphire Fitness. So I'm happy to share that. The other thing that I found going through this in terms of that mindset work and where we go forward, in my last oncology appointment, which was 3 months ago, because I'm now on a 3-month rotation, I said to her that very thing, what do I do now? What do I do now? And my next scan is in 2 weeks. It's February 1st. And I know it's going to be clear because it needs to be. And she said 2 things. She said, limit your alcohol and try to keep your weight down because those are 2 factors. And then she looked at me and said, when was your last period? And I said, right before we started chemotherapy. She's like, yeah, you're postmenopausal now, aren't you? Sorry about that.
Postmenopausal, even though you're in your early 40s, because you would have been in perimenopause when doing this, and it shoots you right into postmenopause.
It's been more than 12 months since I've had a period. I am postmenopausal because it's been 8. And so because of that, this is the chemical menopause. And because of that, she's like, oh, you're going to have a hard time losing the weight. Well, those are the 2 things. And that was sort of it.
I've heard this from so many people who've had breast cancer, and I've had friends who have also been diagnosed with breast cancer. I had a friend actually pass away in her 30s from it. And it's just, there's so little information around what the medication they use actually does. And if you have hormone responsive breast cancer, they're going to give you medications that's going to shut it down. They're going to shut down your ovaries. They're going to shut down ovarian function. The education piece around here so much is so limited around what that actually means for women. And can you give us your experience about what that chemical menopause really started to look like for you? Because everyone has so many different experiences with it. I've heard everything from all of a sudden my hips hurt, all of a sudden my joints hurt, all of a sudden everything hurts. I don't know why, I don't have a period. But the hot flashes I hear are 10 times worse than if you were to go through natural menopause. So tell us what your actual experience was with that chemical menopause.
I appreciate that. I'll say after the surgeries, I then had what they call radiation. So it's a way of treating the tissues to help with recurrence, preventing recurrence. And then after that, they started me on what they call hormone therapy. And so I'm now on a drug called tamoxifen is what I'm taking. Many others, but Amanda, you're spot on. Its job is to take the estrogen and pull it out of my body. The hormone therapy I didn't start until after I'd finished radiation. And so it came in 2 phases. The very first one was while I was in chemotherapy. And for that one, you come back with a lot of pamphlets on how to deal with things. And one of them, if we have time, I would love to share because it was helpful. But the thing that I found was the hot flashes were I didn't know. No one told me I was going to menopause. I thought they said your periods might stop. And I thought, okay, well, athletes have their periods stop and people under extreme duress have their periods stop. And so it made total sense to me. Periods stop, body's in distress. I get it.
Period stopping and ovarian shutdown are 2 completely different things.
They are, but that, so we have to keep in mind, I wasn't eligible for a mammogram because I was under 50. And so at the time, it's now changed. In Ontario, it's less than 40, but those changes came through after I was in the process. So many doctors, menopause isn't a conversation they're really having with their patients because they're in an age where they're already either in it or past in postmenopausal, and so there is no conversation to be had. And so then you have people like myself, and one of the women that I met on this journey, she's 22 and she's now looking at egg preservation. She's looking at what will happen with fertility treatments. She and I are having, they had a conversation with her, but I was in this kind of like weird spot where it's like, well, you're at sort of the end of having kids, and so there's just no conversation. So the hot flashes started, and at the time, because I was in chemotherapy, I thought, okay, I'm doing too much. I thought it was a nervous system response saying, this is too much, you stop whatever you're doing. And I would stop whatever I was doing, whether it was movement, I was thinking about something that was stressful, and I would stop and I would go and have a nap, or I would just sit and have a cup of tea, and it would pass. And then after I started the tamoxifen, the joint pain was probably the one that impacts me the most. It's my ankles, I have all the joints, my ankles, my knees, my hips, my shoulders. I also have some complications because they remove some lymph nodes. So there's other pieces that come into my mobility limitations now, something called cording or webbing. But it was just really, it came in waves. So the joint pain started once I started the tamoxifen. The hot flashes now are very different, and they are intense. My skin is on fire, like it is a heat. And it's kind of funny because for years I was like to my spouse, you need to warm me up. And now we get into bed and he comes over and like snuggles close to me and he's like, okay, I'm warm now. And then he leaves and the whole room has gone up by 2 degrees because we have a temperature sensor in our bedroom. And I'm like, no, you have to go now. I'm sweating. I think we can all relate to that ourselves. So yes.
I get
Yeah.
that from my husband, and I'm not on tamoxifen.
Just talking about the whole chemical menopause. I've heard this from even women that are 35 and how they get flown into it. And you're right, because until the last few years, we haven't talked about menopause. It's been ignored. And now finally it's at the forefront and it's being discussed. Thank God to the National Menopause Show that happens here in Toronto every October for the last 2 years. It's really brought a lot more awareness. All of the fabulous doctors like Dr. Mary Claire Haver, who is extremely well known, who really brought it to social media and really has written books and so forth. And so many other incredible doctors like, Dr. Rachel Rubin, another phenomenal Dr. Kelly Casperson, who is a urologist out of the U.S., who really helps when it comes to sexuality, right? And so how did you and your partner, if you don't mind me and just sharing what you want to share, navigate through this?
Well, I'm just actually, before you get to that, I just
Yeah.
wanted to go back and ask, Brooke, knowing that your body was going to go through all of this, how much information did you actually get from the oncologist about the potential, like, menopause symptoms, how it could affect you in that regard, but also the intimacy stuff too? Did they give you any counseling around that? I know with a lot of cancer care, they have a social worker that might be attached, but what were you given in a way to support the potential fallout from all the treatment that you had?
Such a great question for both of you. I'm going to link them together. When we first were going through the diagnosis, there's a lot more scans that come after the initial biopsy and mammogram. And mine included a bone scan, and my bone scan did not come back clear. So, Amanda, the counseling really focused on helping us cope with the diagnosis and staging, and what that was going to look like and what that was going to be. And so that's where we put our emphasis, and they absolutely provided counseling for that. In terms of overall, there was a couple things. It was when I was in the type of chemotherapy that I was in, and I say this because 50 different types of breast cancer, each one of those has its own treatment plan and treatment schedule. And so one of the things that they had shared with me is that I might be what's called cytotoxic, which means that the cells, the fluids in my body could be harmful to Steve, my spouse. And so, don't share, we were encouraged not to share a toilet, let alone Deborah, in terms of that intimacy. There was one thing that they did recommend, 2 of the pamphlets, literally, on intimacy and sex during cancer. And it's put out by the government of Ontario, if you can believe it. And so there was a couple things. Yeah, I read through it and I didn't connect. You're so deep in everything. You're so focused on the symptoms of, that's a whole other, thick package of symptoms. And hot flashes and things might be in there, but it wasn't a deep discussion. And so it wasn't until after I finished chemotherapy, one of the things that we did find during that time is I was exhausted, and so I had zero desire to be intimate in that way. I didn't have the energy for it, and I was having digestive problems, and some of the medications, they go after soft tissues. So there's an entire pamphlet dedicated to mouth care, because blisters in your mouth is a real thing. There's things dedicated to digestive tract, because that's a real thing that can be affected. And of course, our vaginal tissue is soft tissue too, but they didn't talk about that. So my big surprise, I'll answer this in 2 ways. First, we ended up having a lot of time. He's probably going to be so sad that I said this out loud, but I call it naked snuggle time, which is basically just time together. Sometimes it was just me napping and him just holding me while I slept because I was exhausted. But it was a chance for us to just have a little bit of skin contact and just grounding time together. And that was when things were really bad.
That's intimacy.
It is.
That is
It's in the pamphlet.
Is, Amanda. Yeah. And it's funny because you hear that a lot, especially for women that are going through menopause and post-menopause. You know what I mean? We talk about that. It can be the smallest things, and I think that is so. Oh my God, that warms me to hear you guys would do that. You know what I mean? Because to me, that is just such closeness and such caring.
And vulnerability. Right?
Yeah.
It is.
Being vulnerable.
Sure.
You're both naked and you're just kind of lying together, and him knowing that you're going through this whole process, and him wanting to just lie there and support you that way and be intimate that way with no other pressure is just, I think that is just so, I'm tearing up. It's just so special that you were able to do that, because a lot of couples probably would even have difficulty doing that.
It is a deep act of love. And on this journey, I actually reconnected with an old friend with great sadness. We were both in radiation at the same time and found each other in the waiting room. And so he was going through prostate cancer, and at the same time, his wife was going through breast cancer. And so this idea of what does intimacy look like changes drastically, because he came to my bell ringing ceremony. And for those of you who don't know what that is, some hospitals have celebrations at the end of each round of the end of your treatments, and you come and you ring a bell. It's great. And he came to my bell ringing, and he cried. At first I thought he was sick, and I was like, what are you doing being near me when you're sick? And then I realized he's sobbing. And he said, I'm so sorry. I'm on anti-testosterone. I get hot flashes and I cry about everything.
Yeah, absolutely. One of the things I hear you saying, like the underlying themes through the cancer journey and also the menopause, perimenopause journey, is this deep call back to the body in ways that are, yes, painful, but also really powerful. When you were talking about your friend, I also have a male friend who was diagnosed with breast cancer. And so it is also not gendered, right? It can impact lots of people. But one of the things he said to me that was really interesting was a conversation he had with his oncologist. And his oncologist looked at him and said, "What happened in your life about 6 months ago?" And my friend was able to say, like, he had had an exceptionally stressful event happen about 6 months ago. And his oncologist said, "This is a trend I am really starting to notice in people, that there was something they experienced. There might be a pre-proclivity to cancer in a person or a family, but we also know that with breast cancer, the majority of cases, I can't remember exactly the stat, maybe Amanda, you know it, but it's like 90 some odd percent is not genetic."
Very high percentage.
Yes.
Genetic.
And so it is this call to turn back and say, what are the things perhaps that I've been holding? What are the things that I've been ignoring? Because, yeah, there's all the science part and there's all the medicine part, but there's also this human living underneath that. And I thought that observation by an oncologist was so interesting. So what I'm wondering is, what are some of the calls back to your body that you have valued through this process?
Oh, I love that. There's a couple things. I really started spending a lot more time journaling. I know some people who are just, binge watch on TV, and don't get me wrong, there was TV involved, but that's not my thing on a normal day. I'm not a TV watching person. And so I journaled a lot. I read a lot, as you can see. I had a lot of books gifted to me, which I thought was interesting. One of the couple things that came up, I started having UTI, and that it was a combination of family doctor and then my oncologist combined. I was very blessed. My case nurse is actually, her oncology specialty is gynecology. So she had some tips for me as well as we went. And my family doctor had said, this is related to the dryness. And the dryness is one of the symptoms that comes from the damage from chemotherapy. And so she put me on, and Deb, I know that pleasure pause is sort of external, and I heard you talk about how messy coconut oil is. I got to tell you, for anyone who's ever taken Repagyne, that stuff just pours out of you in the middle of the night. Use a towel. No one warned me. And so that was, all of them had made the same recommendation. And sure enough, it helped with the UTIs. The thing that was so challenging, Lisa, on this coming back to the body, let me tell you how much I was looking forward to. Okay, I'm done chemotherapy. I'm physically safe. I've got more energy than I've had in months. The pain was unreal. It was blinding. It was so bad. And I was crushed. That was one of the things that almost broke me. And so having these conversations, it's the now what do I do? And it took about 6 months to heal. Interestingly enough, dryness is in the brochure. And they strongly recommend using a dilator throughout treatment. And I missed that bullet point, and I just wasn't in that headspace. It's the tightness and also just the tissue damage in general as it's starting to repair. And so that was something that was really, really challenging. And so having to come back, I've been dealing with what happens if one of my breasts needs to be severely changed. What happens if my vagina is not functioning properly anymore and doesn't broken. What does that look like? And so a lot of time struggling with those. But at every moment, I really tried to lean into curiosity. So immediately, in that first meeting we talked about, I said, she's trying to get me to make a decision. I said, great, then I want to talk to a plastic surgeon because I want to know what all my options are. And they were like, fine. And she was great. She spent some time with me and explained all the options, which was really helpful. And one of them was about tattoos. And so now I'm involved with the Healing Ink Collective and the amazing work that they're doing to help women have three-dimensional. It looks 3D. They're phenomenally beautiful artwork. And one of the cool things about that is that they are really advocating to make this available. One of the downsides is it's not covered by OHIP, except under very specific circumstances, which not all women have access to. So, thinking about what this healing journey is, what would I need, you really leaned into advocacy. I'm not going to call it research because I'm not a researcher, but a lot of reading and a lot of asking questions. I also, you talked about leaning into the body. I'm an engineer by training. Project management and decision making and risk are things that are very comfortable for me. I'm also an educator and a speaker, and so I really think about this interaction. So we came out very early and said, listen, you got 2 engineers in the room. We need you to be specific. When they went to do the radiation, we met a radiation oncologist. So I have 3 oncologists, a surgical, medical, radiation. And my radiation oncologist, turns out he's a few years, about the same age as me, maybe 1 or 2 years older than me, and we had gone through the same engineering program. He eventually left and went to med school, and I went on to business school. And I said, listen, my background's in engineering physics. And he went, oh. And I said, I want to know everything. And he's like, okay. And so it was cool things like when I met with the actual radiation team later, they were like, do you want to see what we do? And so I got to see the modeling that they use, and they were, and my and having all these conversations. I'd come home with my husband, and I'm like, oh, you won't believe what I learned.
How do some things help the journey though? Like sometimes leaning into those parts of you helps you cope a little bit too, right? You can kind of see the cool things because you understand it, and I think that's really neat that you used what you knew or what your gifts are, and kind of turn that into a way of coping. And that's, a lot of women would probably take that and learn from that too for
And
them.
I think that is really important. And I know that, you shared that in our questionnaire about the curiosity. And I know that myself, I'm a very curious person. I need to understand how things work. Then I can make a better decision, and I feel more peace within inside as well too. But I know there's women and there's men out there that don't have that instinct of curiosity. And so if I can suggest something is that to our listeners is that if you're not that curious person, find somebody in your life that is. Someone that can be there to support you with their curiosity, because they can help you, because you may not be able to do that, but I can just see how it is so beneficial in so many avenues when it comes to going through something like this. It's finding those individuals in your life that can really help you in certain areas that maybe you're not strong in, that can really be there for you.
I did want to ask before we move on into letting you tell us what you do in your advocacy work, but what advice would you give couples who are facing this type of challenge? What would you say to them, to that couple who is going through a breast cancer journey at this time? Because there's so many out there.
There are. I'll first say to friends who have someone in their life. My doctor, actually, her nephew was diagnosed with cancer, and she asked me, what do I do? And I said, don't ask him how he is. Ask him about something specific that he can answer, because it's a heavy question and you don't know how to edit. And also, I said, keep sharing your life, because you become so insulated. It's just nice to have glimpses back out into the real world. In terms of couples, I mean, we talked about it earlier. I am blessed. I have such a loving spouse. And throughout this, even for the surgery, this was my decision. This was my body, and he's going to love me as I am. And I think really leaning into the fact that there are resources. I know amongst your group, there's phenomenal coaches. There are something as simple as a pamphlet that gave us some inspiration to try something that wasn't part of our life. And now having a nap has become an integrated part of our intimacy. We have naps together. And snuggle time, and that's now something that I'm like, I think I want to keep this, and he's probably cringing on the inside if he hears this, but it's something that was really, it's meaningful, and so it's pushed us and I think in a positive way, to have way more conversation than we used to. Because when I was in my 20s and 30s, it was, we're having a great time. And it was more like, do you want to try something for the sake of trying it? Now it's, do you want to try something because it doesn't hurt? Do you want to try something because it is actually just more enjoyable? Do you want to try, should we shift position, not because we want to shift position, but because someone's shoulder or elbow is starting to feel kind of achy, right? But
Oh God, yes.
you have to speak up. You have to speak up.
And you have to be sharing your vulnerability. And when you go through something like this, Brooke, okay, you have to get really vulnerable, right? So, and to be able to share that vulnerability with your partner is one of the most difficult things, I think, in a lot of relationship, is the communication of vulnerability. And I think this really puts that into place here.
And were you ever offered, going back to like when you were saying that things really hurt, were you offered anything that, other than like the messy coconut oil that runs out, were they were they offering you any other kind of relief for that? I know there's lots of research now being done regarding vaginal estrogen in breast cancer patients and that type of thing. And I'm just wondering if any of those conversations had ever come up with yourself and the oncologist, and what the medical community is telling you about those kinds of things at this time, because that's so important, like getting back into your life and your intimacy once treatment is over. We sometimes forget that, yeah, treatment's over, the cancer might be in remission, or we're just monitoring now. But what's that woman's life like now that she has finished this and she's trying to get back into her life the way it was before cancer? Like, what type of aftercare do they give, or what have you been offered in those terms?
For myself, I don't view trying to get back. And the reason why is because I can't get back. I've been surgically, medically changed. My perspective has changed. So I don't want to go back to who she
I guess
was.
I didn't mean it going
No.
like,
No, but it's an important distinction.
Yeah.
I try, Amanda, this is something I've been working on with my therapist. So it's an important distinction. How do I go forward from here?
Right.
And so things that they gave me, the Repagyne was to help with the UTIs, and the coconut oil was to help as a lubricant. And I'm so blessed to have other women in my life who have gone through this journey before me. And one of them, funny enough, she's like, listen, Sahara Desert olive oil was better for us than coconut oil. And I'm like, and then I met Deb, and I was like, oh no, this is much cleaner. This is much nicer.
And just so you know, Brooke, you can put it up there. You can cut it into little pieces, and you can insert it with your finger.
Yeah.
It is no problem at all. It is just as natural as coconut oil. There's nothing that's going to harm you. So you can do that.
The HRT, interestingly, I'll be asking again. The answer was, while you are in active treatment, I cannot prescribe HRT to you. Right. It would be counterintuitive.
Right.
And so because of that,
includes the vaginal estrogen.
That includes the vaginal estrogen. And make no mistake, that is on my list of things to ask for today. I'll also be asking about osteoporosis, because I'm now at high risk.
That's another thing I was going to ask about.
Yeah, and I'm going to be asking also about the estrogen, I'll call it an anti-estrogen that she's put me on. Why did we choose that one? Because we didn't actually talk about that. And so I'm going to ask about that as well. And so what does advocacy look like? You have to keep asking. You have to be bold. I was bold, and with my husband sitting beside me in a room with an oncologist and a nurse, I said, sex is painful. I don't know what to do. What have you got for me? And it was, the answer at the time was coconut oil, but I was willing to say it out loud. And I, whether he was comfortable or not, it didn't matter. It was my question to my doctors. And I say that he's with me. My spouse came as my second pair of ears to all my doctor's appointments, partly to also give how he was seeing me, because sometimes I felt better than I was. I didn't realize how sick I was. And so he could speak up for me for that and give a perspective and lens, but also to hear what they were saying. We could come out and we both took notes and we both remembered different things. So having a second pair of ears.
Tell us about what you're doing now. So what's your advocacy work? The seasonal blueprint, what inspired you to create it, and how it's impacting others and who've participated with you.
Thank you for that. I wanted to pour my energy into something. I'm a very industrious person and an entrepreneur at heart. And so even though I put my speaking and my teaching on pause, I really wanted to do something. And so for Christmas, I created a workshop for my parents. And I said, this hijacked 2024 and it's going to hijack part of 2025 for us. And so I wanted them to be able to go into the year with intention. And they loved it so much, they asked if I would be willing to do the workshop for some friends of theirs. And I said, no, surgery coming up. I'm too tired. I said, but I'll sell them the workbook and let's make it a fundraiser. And so last year, I raised almost $7,000 for breast cancer research, specifically for those pilots that are hard to get funded by the larger agencies. And those are the ones that are so important. I will say I know that research has saved my life. It is because the type of cancer that I was diagnosed with has these receptors. They can do things to support me. And so I wanted to be able to pay that forward. And so that is at its heart, it is about really looking at what was last year. What is it you want to go do going forward? What it is not is a goal setting. It's not about your typical SMART goals. You're not going to find that in there. What you are going to find is really thinking about what do you want? How do you get into your calendar? How do you start looking at resources? So it's about perspective. Deborah, you talked earlier about, this way of looking at things and thinking about things. This is where I put my heart energy into doing that for others. So a lot of questions, not questioning, just questions that you can sit with. And some of them might be a question that you don't want to answer. It's your book, you don't have to. And some of them might resonate deeply. And so that's the seasonal blueprint.
And I did go in to see it, and I think I'm going to be getting it because I find it so interesting just for me and in my own life. You know what I mean? And so I think I want to make sure that everyone understands it's for anybody and everybody. It's not just people that are going through cancer situation. Anything like $37.50, either US or Canadian. I love that it's going to an extremely good cause. And I really applaud you for going through something like this and then finding ways of how you can give back for something that saved you and all of this research and helping those that come after you. I think that is important. So thank you for that, Brooke.
Did you have something to say, Lisa? Did you want to add?
I just was going to, on Deb's point, thank you, Brooke, and to all of the women who are going through this and are sharing their stories and are doing this advocacy work. Deb, like you said, making things better. And I would be remiss without taking the opportunity to also shout out Jenny Dale, who is the founder of Dense Breast Canada. And thanks to her advocacy and the advocacy of her organization in Ontario, Alberta, BC, I believe it's starting to move throughout provinces, we now have a self-referral program. So you do not have to go through your healthcare practitioner. If you are 45, you can, and Deb, this is something we can make sure is in the show notes.
Yes.
The link to it is to go to the provincial website for wherever you're at. It shows you the wait lists for clinics you can get on and you can refer yourself, which really helps give you some power.
This past year, I turned 45 last year. And I went to my family doctor for my annual physical, and my doctor just kind of did like his, breast exam and didn't even offer me a mammogram. So I was really thankful that I was able to have this program available where I could self-refer because I'm leaving and I'm going, he didn't even offer me a mammogram. Like, what's up? What's up with that? Right. And I think it was just early last year that whole self-referral thing came out. So I'm like, yep, I'm booking myself in. I got myself in within 6 weeks, 8 weeks or something.
It's awesome.
And I had my first mammogram, and thankfully it is completely clear at this time.
It is
Really glad that we have that.
Yeah, absolutely. And it is a smooth process. So mine was very similar to yours. I was 47 at the time, decided I'm going to do this, really clear. And the other component that I think is really important that they include in the results is your
Yes,
your
the type of
breast
breast you have.
density,
Yeah.
right? So that report now comes to you. And that information can be a game changer in knowing what your breast density type is. And if you're not sure how to read that, again, there's lots of resources and people who can help support you with that.
Appreciate you sharing that, Lisa, and we'll definitely make sure that is in the show notes for everybody. So thank you for that.
So to finish off, Brooke, what advice would you give someone who wants to use their story to help others, but isn't sure where to start? I've had a couple of friends actually in the last year that have been diagnosed with breast cancer. And, one is like really internalized everything. And one is starting to share her journey on, in the social media space because she's finding that, it's actually helping her with her journey. So, what advice would you give to someone who wants to share their story to help others, but they're just stuck?
I would say, very first thing, decide what's important to you. So for me, I leaned into the seasonal blueprint as and fundraising for cancer research. So cancer research became the thing that was really important to me. I also am very strong around self-detection because early detection is what saves lives. There's more options. There's just more options for the doctors. So mammograms is something. And so on the first of every month, I post, and I actually ended up collaborating with an incredible artist in Chicago. Her name's Chelsea Tam. She created a piece of artwork for me. And on the first of every month, I will post it and talk about, hey, go get either a self-exam and here's how to do it, or a mammogram. And so that was sort of the thing. And then people can become curious, and then you can share maybe your experience, or you can start to find ways of sharing to protect yourself in a way. You don't want to share what you don't want to share, but the things that you do want to share, you can find an avenue to share it that has some commonality with people. And what I have now had is that women who said, I'm going to get my first mammogram because of you. And I always say, please, no matter the results, if you're comfortable, let me know the outcome. And I get voice notes all the time. I did it, came back clear. I'm going. If I don't hear, I'll check in. Are you, how did it go? How was your experience? Some people don't have a positive experience, and some people have a great experience. And so that's been a point of connection. So I would say find the thing that you're comfortable talking about and let that be the little point to start. And then over time, as you get more comfortable and you see how people are responding and what they get curious about, then you can start sharing more of your story.
And I want everybody to know that I will have all of Brooke's contact information, so forth, in the show notes, because I think it's really important. You need to have people and resources like this to really help you get through this. And I think that's the key. It's community. Community gets us through everything. We hear ourselves at Unmuted, the Midlife Roundtable podcast. We really want to make sure we help build community for women. It's really important to us. So, Brooke, thank you. I really appreciate you taking this time to share your story and who you are as a human.
Just to piggyback on that, I had someone make a comment on one of my posts on Instagram this morning, and she is a breast cancer survivor. And she was talking about, she just kind of dropped in my comments a little bit about her journey with breast cancer and stuff. And I said to her, actually, we're going to be putting out a podcast this month. We're going to be interviewing somebody who is sharing her journey. So, tune in. Uh, so, it's already kind of out there that someone might be looking for some support. And I always love meeting people like you, Brooke, to kind of just bring into my community as well, so that I've got someone to, refer people to if they need additional support.
Finish off, because we did mention a little bit, and
Mm.
because we are sponsored by Pleasure Pods for our podcast, I do want to really talk about this just for a brief moment. One is that Pleasure Pods is used as a personal lubricant as well as a moisturizer. And Pleasure Pods being 100% natural. Only the 6 ingredients, mainly made up of the mango butter, the cocoa, like our beautiful chocolate, and the kokum, which comes from the mangosteen fruit. That is 99% of the ingredients. This is very safe to be able to insert. So, as I say, because it's a solid, you can cut it up. You don't insert the whole thing. You can cut it up into little pieces and insert it into little pieces, and it doesn't come goobing out and doing any of that stuff either. And what I love about it is you get to manage how much of a piece you want to put in. I always say to everybody, start small. and then just gauge that from there. And then it's also just great as a lubricant overall, outside, toys, whatever it might be. Pleasure Pods is now available in the United States. So check us out at thepleasurepods.com. And Brooke, thank you.
You can follow or subscribe on Spotify, Apple, and YouTube. And be sure to follow us on Instagram and Facebook at Unmuted Midlife Podcast.